Thank you all for joining me in this EHR presentation. My name is Estelle Hernandez, and I am the CEO of ABC Medical Center. As most of you may know, ABC Medical Center just purchased a comprehensive electronic health record system. The EHR system will be taking the hospital's paper charts and converting them to digital versions, making it instantly and securely available to authorized users. The chart will become the patient's lifetime record of their health. Although traditional paper charts may be easier for the documenting single visits, reviewing multiple visits or types over time can be a challenging and time-consuming process. Paper charts will update manually, resulting in delays for record completion taking anywhere between 1 to 6 months. Paper charts risk being misplaced if several providers review them to decide the treatment for the patient. If a patient needed information for their charts, they would have to sign a release of information to view the medical records. Another limitation of paper charts was the lack of security. Even though charts were locked in cabinets or closets that required an ID and sign-out procedures by authorized users, if a chart was mistakenly left out in the open, unauthorized users could potentially view confidential patient information. Unfortunately, there are no alerts on paper charts, so we wouldn't know what information was being viewed. While this process may seem intimidating to some, teamwork can make this project a successful one. Everyone must participate in this transition, as each of us will play a vital role in reviewing and keeping our patients' information safe. All of us need to understand which information we will have access to. For example, the receptionist, nurse, and radiographer will have different tasks and responsibilities, so they will not have access to the same information. Healthcare providers play a critical role in the adoption of EHR systems. You will be responsible for reporting any issues with functionality, usability, workflow, and how it affects your patient's care. The EHR will help our physicians and medical team provide better patient care by providing accurate and complete record information of our patient and enabling access to those records as needed for effective and efficient care. The providers will be able to diagnose patients, reducing medical errors effectively. They will also have access to safer and reliable means of prescribing medications. This system can address issues in all areas of healthcare delivery and transform how the hospital collects, stores, accesses, processes, manages, and reports patient data. There are 3 ethical priorities everyone must learn. Shared information such as lab results, radiological results, treatments, progress notes, and diagnosis can be stored in the EHR by scanning the data into the electronic chart and must be protected. This information should only be released with the patient's permission. This information can only be used without the patient's consent if a provider is treating the patient. Federal regulations such as the HIPAA law and Health Information for Economic and Clinical Health Act mandate the security of medical information. Designating privilege is a vital aspect of medical record security. For our patients to develop our trust, we must protect their medical records. The EHR training will make our staff more aware of the security measures needed to protect our patients' data. Everyone will be held accountable for the use and misuse of the information they view and change. Physicians should be able to search the patient's chart simultaneously without having to use other means of communication, such as cell phones. Testing the information in a cell phone. If the cell phone gets lost, the information is out there for everyone to view. When choosing an EHR, we want one that will alert us if document integrity has been compromised. For example, if a health provider is entering a patient's vital signs and mistakenly inputs the wrong information, an alert will let the provider know that the information was entered wrong or should be double-checked. One of the exciting features of our EHR will be a patient portal called MyChart. MyChart is a free, secure website and mobile app that gives our patients direct access to their medical records. With MyChart, the patient creates a username and password to access their records. Once inside the patient portal, MyChart allows the patient to schedule and reschedule medical appointments, view the health summaries of their past appointments, view test results such as lab work and radiology reports. Patients can renew their prescriptions, access trusted health information regarding any medical issues they are having, communicate electronically with their physicians, send secure messages to their medical teams, and manage health information in communication with their physicians. MyChart alerts patients when screenings are due, such as annual physicals or mammograms. One of the advantages of utilizing this technology is that the patient can give other clinicians authorizations to access information stored in the electronic medical record. The physician can make clinical decisions, providing better, safer, and higher quality patient care. Technology has changed how patients view health-related issues. Patients are using their computers, their cell phones, and the internet to gather medical information. With the use of the internet, patients have become advocates for the quality of the healthcare they want to receive. They search the internet for health information regarding their symptoms and conditions to better understand treatment and options to manage them. In February 2011, Pew's Internet and American Life Project found that 8 in 10 internet users looked online for health information. In 2013, they found that the internet was being used as a diagnostic tool by 1/3 of U.S. adults. Social media platforms like Facebook, Instagram, Pinterest, LinkedIn, and TikTok allow for communication between patients and other health resources across the country and worldwide. According to Ericsson, a global communications technology company, by 2021, there will be 6.3 billion people with smartphone subscriptions. Like these online patients create chat rooms and forums and support groups such as Patients Like Me, Cure Together, and Inspire, all which help the patients connect for emotional support, ongoing learning, and advocacy. Google, Facebook, and Amazon have set up web browsers like Health 3.0 and Digital Health, Medicine 2.0, Connected Health, and mHealth, allowing patients to have a more personalized search of their health experience. mHealth is a mobile technology that allows anyone with a smartphone to access thousands of health and fitness-related applications. Smartwatches have sensors that track fitness, wellness, and healthcare delivery of the patients wearing them. In 2015, Apple allowed consumers to participate in healthcare research regarding the heart. According to Apple, within 24 hours of launching the Research Kit Heart Study, over 10,000 iPhone users signed up. Also taking advantage of this technology are healthcare insurance companies, such as Blue Cross Blue Shield, which is using their social media to promote well-being. On this website from its members, Blue Cross Blue Shield allows the users to have discussion threads, have access to nutritional, cooking, and health coaching information. While I understand that you may have questions and concerns, this process will not be easy and happen overnight. It's going to take time and patience, but we must remember our goal, the safety of our patients, and increasing the quality of healthcare we provide. Thank you all for listening to my presentation. Without you, the staff at ABC Medical Center, we would not be able to provide the healthcare that we provide all of our patients. So thank you again for your hard work and dedication. Have a good night.